Okay, so we've been called to a female who's fallen 2 meters from a tree. Scene safe, correctly Pigo. Ready?
Yeah, sure.
Okay. Hi, we're from the ambulance service. My name's Chris. This is Holly.
Hi.
What's your name, please?
I'm Tessa.
Tessa. Alright, Tessa. Can you tell me what happened?
I was cutting a branch down. I was up on a tree and I lost focus. And next thing I know, I was falling.
Alright. So immediately I can see a large laceration on her left forearm. So I'm just going to get you to put pressure on that first. Thank you, Holly. Okay. Before I bandage it, I'm going to quickly clean the wound. Alright. As well as the dressing itself. Okay. So what hurts?
It's just my arm and I feel one of my ankles as well.
Okay. So did you feel anything funny at all before you fell?
No, I just lost focus.
Okay. Alright, so if the bleeding continued, I would apply another bandage, otherwise a tourniquet. So I'll just demonstrate that now. I'd only do this on a single bone limb, never on a joint, and about 10 centimeters proximal to the wound. Alright, Tessa, so this is going to be uncomfortable, but hoping it will stop the bleeding.
Okay.
Put that on tight. Alright. Is that alright?
Yeah.
Okay. So I'd then write the time on that, and we would not take that off until she's gone to hospital. Okay? So because Tessa's fallen from quite significant height, I'm just going to do a quick trauma sweep. Is that alright?
Yeah.
Get start from the top here. Thanks. Just shout out if there's any pain, alright? Okay. Is it more to the back here? Okay. So there's tenderness around the neck here. That could be a possible C-spine injury. So I'll just continue doing that. Nothing? Alright. So I can immediately see there's some swelling, there's there's abnormality there, the angle it's on, so I'll quickly just check if there's a pulse. Capillary refill. It's not too bad. So there is blood getting to it, so we'll sort the stabilize the neck out. Could you please just pass me the collar and hold it here?
Yeah.
Thank you. Alright, so I'll just measure from trapezius to the bottom of the chin, alright? Okay. It's 1, 3. I'll just lift the head up. Okay, 1, 2, 3. Tessa. Alright, so the collar could decrease venous return and increase intracranial pressure. We wouldn't apply it if there was severe damage to the neck itself, and it can be quite uncomfortable, but that should stabilize your neck. Alright?
Yeah, I'm good.
Cool. So I'll now take some vitals, if that's alright?
Yes.
With the good on here. Have you ever had your blood pressure taken before?
No.
going to get tight, alright, around your arm.
Alright.
Thank you. Okay. While I'm doing this, Holly, could you just get the splint ready?
Yeah, sure.
Alright, so I'm looking for a systolic range of around 120 to 140 over 80. Okay. So it's a little low there. I'm just going to quickly take your heart rate. So the heart rate should be between 60 to 100. Count to 15 seconds in terms of by 4. Alright. At the same time, I'm going to take Tessa's respiratory rate. I won't tell Tessa. If the patient knows they can change it. And I'm looking for 12 to 20 breaths per minute there. And they're both a little high. That could indicate Tessa is in, put that down now, mild shock. So I'm gonna oscillate as well. Just gonna have a quick listen to your lungs, alright?
Yeah.
Just gonna check your food. Just take a big breath in for me. And again. And again. Okay, just checking that both sides are equal. Am I right to just lift up your shirt?
Yeah.
Okay. No crackling, no wheezing, no bubbling. Okay, so because Tessa could be in mild shock, I would get my offsider to administer about 5 milliliters of oxygen using nasal prongs. All right. Now, Tessa, how is the pain?
That's
From 1
really-
to 10, 10 being worst.
Again, 8.
Am I right? Okay. So I'm gonna offer you some pain relief here. Have you seen this green whistle before?
No, I haven't.
Butoxyflurane? Okay. Do you have any allergies?
No.
Any renal impairment?
No.
Okay. Have you heard of malignant hypothermia?
No.
Alright. So Tessa is able to take this today, okay? So what you're going to do for me, it is self-administered, so I'm going to get you to hold this. Put this around your ankle. Before I do that, Tessa, I'm just going to get my offsider to check the expiry date and the drug itself. Okay, so
Methoxyflurane, 3 mils, expiry 2020.
thank you, Holly. Appreciate it. Okay, so I read the same thing. Alright, now could you please put that around here? Around your wrist. Okay, you're going to blow through in and out of the whistle there. Okay, make sure when you blow out it is out of the whistle itself. And it goes through the filter and we're not affected by it as well, alright? Okay, so using the acronym plus discs, I've determined that this could be a possible fracture due to the pain, the lack of movement, and swelling. Okay, so I'm just going to compare both feet now, alright? Check the capillary refill, both under 2 seconds, okay? Can you feel that, Tessa?
Yes.
Both feet, alright, let's check the temperature, that's slightly colder. That's alright, let's check both pulses. Okay, I'm now gonna try align your leg here, okay? Stabilize it a bit, this is gonna hurt, so take big deep breaths on the reflux for me. Right, Holly, I'm going to lift. And on 3, just going to slip that under, please.
Yep.
Alright. 1, 2, 3. Alright, doing well, Tessa. Okay, so just straighten it up there, help with blood flow. I'll now tie just above the ankle or the fracture, and Holly, could you please tie just below?
Yep.
How's the pain?
Better, yeah, that's
Good.
good.
Right. I'm just going to quickly check again. Got pulses. Okay. Capillary refill. Right, so we've got good blood flow to the ankle, and she is ready for transport.